This video will talk through the stages of labour for midwifery students. It's crucial you know clearly the definition of each stage of labour in order to give appropriate care and recognise deviation from the norm. It's also something you'll likely be assessed on during your practice assessments. Here you can see a diagram of the stages of labour, along with a timeline starting with the initiation of labour. If we go from left to right, you can see we've got the first stage of labour, which is divided into the latent first stage and the active first stage. We then have transition, followed by the second stage, which is divided into the passive stage and the active second stage. This is followed by birth, which is then followed by the third stage and the immediate postnatal period. This diagram does not have specific time limits, as everybody is individual and each labour is unique. However, there are rough guides for the time we can expect each stage to take, as suggested by current NICE guidelines. The onset of labour. So labour onset usually occurs spontaneously between 37 weeks and 41 weeks plus 6 of pregnancy. These are considered term gestations. Anything before 37 weeks is considered preterm, and after 41 plus 6 is considered postdates. Around 2/3 of women will enter labour naturally, typically experiencing the onset of regular uterine contractions with or without rupture of membranes. During this time, women may experience what's commonly called a show, which is the mucus plug or operculum coming away from the cervix, and in the days leading up to the onset of labour, they may also experience on and off tightenings or mild contractions, as well as other symptoms such as diarrhoea. The exact trigger for labour commencing is not fully understood, but it is thought to be a complex interplay of hormonal and mechanical factors involving both the mother and the baby. Key factors include decreased progesterone towards the end of pregnancy, increasing oxytocin and oxytocin receptors, and prostaglandins released around the cervix. The first stage of labour is divided into two periods. The latent first stage of labour is a period of time that's not necessarily continuous, when there are contractions and there is some cervical change. In this stage, the contractions may be mild and infrequent, and they might build up over this time. They might stop and start, sometimes being regular and then sometimes fading away. There will be change in the cervix, namely effacement and dilatation during this time, and how this happens will depend on the parity of the woman. But the cervix should go from closed to 4 centimetres dilated. In terms of expected length, the latent phase can last for hours or even days, and it can be very intermittent. There's no specific guidance on its length, so each woman should be assessed holistically in order to identify deviations from the norm. The established first stage of labour or active first stage of labour is where we can expect regular contractions, somewhere between 2 to 3 in every 10-minute period. They should be lasting around a minute and they should be moderate to strong. And we're also expecting progressive dilatation of the cervix from 4 centimetres until 10 centimetres or fully dilated. And during this time, women should be receiving one-to-one midwifery care. Whilst the length of the established first labour varies between women, NICE guidelines suggest that first labours last on average 8 hours and are unlikely to last over 18 hours, and a second or subsequent labour lasts on average 5 hours and is unlikely to last over 12 hours. The second stage follows, and this definition of second stage says that it begins with the full cervical dilatation and ends with the birth of the baby. And the definition of passive or active second stage of labour will look different depending on whether the woman has epidural analgesia. So a passive second stage of labour is when there is full dilatation of the cervix before or in the absence of involuntary or active pushing, and an active second stage of labour is when the baby is visible or there is involuntary or active pushing with full dilatation of the cervix. So for nulliparous women without an epidural, birth would be expected to take place within 3 hours of the start of the active second stage in most women. And for a multiparous woman without an epidural, we'd expect birth to take place within 2 hours of the start of the active second stage. For women without an epidural, the active second stage often begins when they begin involuntary pushing, because it's an overwhelming urge that they are unable to suppress. However, the passive second stage may be diagnosed by a midwife either through vaginal examination or through external signs such as a purple line or the rhomboid of Michaelmas. For a nulliparous woman with an epidural, Birth would be expected to take place within 3 hours of the start of the active second stage in most women. But be aware that these women may have had their passive second stage of labour diagnosed by vaginal examination, and they may have had a passive active stage of up to 2 hours after full dilatation has been confirmed before that active stage starts. And for multiparous women with an epidural, birth would be expected to take place within 2 hours of the start of the active second stage of labour in most women, but be aware that these women might have had a passive stage of up to 1 hour after full dilatation. So again, dilatation might have been confirmed, they then had a passive hour where they're not encouraged to push before active pushing begins. The third stage of labour, this is the time from the birth of the baby to the expulsion of the placenta and membranes. And a prolonged third stage of labour is diagnosed if it is not completed within 30 minutes of the birth, when there's been active management of the third stage, or within 60 minutes of the birth if there's been a physiological approach to the third stage. After this, we need to follow guidance on retained placentas. So back to my diagram. So a note on transition. The transition phase is this short period at the end of the first stage of labour, when the cervix dilates from somewhere around 8 to 10 centimetres, and contraction patterns can change. They can become very strong and long and close together, or they might ease off. This time is often highly emotional, and women might feel teary and unable to go on with the labour. It's a challenging but brief, hopefully brief phase that can sometimes be a rest in preparation for the second stage, or it can sometimes be a real struggle. But it's a crucial sign that the second stage of labour is imminent. And a final note, the definitions of labour discussed in this video categorise the stage of labour in terms of cervical dilatation and contractions. However, each labour is different. Every woman needs to be listened to and observed as an individual, and as you will discover when you start to care for labouring women, they do not fit inside the boxes prescribed by guidelines. So you may well find that women are in active labour far before the guidelines, especially around dilatation, would say they are. And it's important to give holistic midwifery care in these circumstances. Okay, thanks for watching. That's a short summary of the stages of labour.